Kathy is going to perform the next exercise on her hands and knees. This is said to be very beneficial for people with osteoporosis because it not only focuses on strengthening the wrists and hips, it also can focus on the spine and pretty much the whole upper body. She's going to perform what we call reciprocal extension, where the opposite arm raises with the opposite leg. She's keeping her tummy muscles engaged the whole time and her pelvic floor muscles tight as well. She's going to keep her head right where it is in neutral, maintaining this neutral spine the whole time with the eyes pointing down. She's not going to lift her head at all. Go ahead, Kathy. Opposite arm, opposite leg. That's perfect. She returns her arms and legs back to the same position. The arms are under the shoulders and the knees are under the hips. Good, Kathy. She's trying to maintain this neutral spine the whole time. She's not lifting her leg too high. Perfect, Kathy. Keep breathing. To be able to understand the form and perform this exercise properly, it'll be most beneficial to do it for a whole minute. Notice Kathy's giving it a small pause up at the top and returning back to the position. And Kathy is here with the deflated TheraBall underneath her. She's going to perform a plank. This is a safe abdominal strengthening exercise for somebody with osteoporosis because there is no flexion through the spine. She's going to perform this exercise for 10 seconds and then she's going to lower back down. The most beneficial way to perform this exercise is to maintain it for 1 minute. I'm going to show it the modified way. As she pushes up, the force is going to be driven down through her arms, which we know is beneficial for a weight-bearing exercise. And she's also going to be pushing back through her heels. This is the correct form for a plank. Okay, Kathy, so go ahead. She's going to come up. She's going to breathe the entire time, keeping her stomach muscles engaged. Go ahead and just lower your head down a little bit. That's perfect. She's keeping this spine nice and flat the whole time. 5, 4, 3, 2, 1, and lower down slow. And then she's going to come back up and hold it another 10 seconds. 5, 4, 3, 2, 1. Again, it can be performed for 1 minute, but it can also be held for 10 seconds. I have Kathy here on a deflated TheraBall. A folded pillow can also be used as well, but she's going to be on a deflated ball. She's going to perform this exercise that is going to be good for posture and upper spine alignment. She's going to gently push up, and what's going to happen is the force is going to be driven down through her elbows, which we know is beneficial for weight-bearing exercises for somebody with osteoporosis. She's not going to have any movement through the lower spine. It's all going to come from up here, and she's going to keep her eyes down through the entire exercise. I'm going to have Kathy perform 10. Go ahead, Kathy, let's show the first couple ones. That's perfect. Notice that all the motion is coming from here. Her eyes are staying down. And as she pushes up, she's exhaling, and the upper neck is extending slightly. And as she lowers herself, she's breathing back in. She's breathing out. Perfect. She's going to go 5 more. She takes a deep breath in. And a nice exhale. Notice all the motion is coming from here, driving that force down through her elbows. Great, Kathy. 2 more. Up through here, lower down, and 1 more. Perfect, Kathy. Relax.